Hello, everyone. It's Dan Lannon here, waiting for some people to sort of join in. The numbers are really bouncing up right now, so I'll give them a minute and allow people to join in and for us to get settled. So it's a nice, beautiful May afternoon, and so hey, Sharon, there you are. How you doing? We're just gonna wait a couple minutes. People are rolling in right now, and so give another minute for them to get settled. And so, how you doing today, Sharon Pitts?
I'm doing okay. It's beautiful out.
Good, good. All right, so here we are, May 26th, Tuesday, May 26th. A few people are still rolling in, and hopefully everyone's enjoying the good weather and taking a minute out of their day to join on and get updated, and then we'll go back to what everyone was doing. But still really jumping up there. So
yeah.
All right. So again, thank you all for joining us. We as we remain committed to doing these until Tuesdays, until we really have some more information or a set plan on what is next. And so as we have it now, we are in the same situation as we were last week. We have one positive case. That person is a female. She's staying at the center right now. She's doing well. She's in her quarantine period right now, and has had some challenges over the weekend, but overall is doing fine today. Sharon can update more on that. Also, as far as everyone else, we've had some test results come in for one of the houses that we wanted to have tested over the weekend, and all of those tested negative, which is great news. And so we are still working towards having all the houses tested, and we should have that completed this week. The anticipation is that we will have that completed this week, and then we will then move our discussions to be sort of what is next in the planning phase of closing down the center or dealing with more positive cases. But that would get us through the first round of having all houses and individuals tested, and so. Now we know that's just a snapshot in time, and so that certainly opens up more discussions and greater updates that we will have along the way. Unfortunately, we don't have any in-depth details from DDS as far as the opening back strategies and guidelines yet. We anticipate that coming soon, shortly, and so in the next week certainly. But we do have a small group meeting and going over some contingency plans that we have set up, and also just to make sure that we have supplies that we know we are going to want to have when we open back up. The capacity levels, I know I received an email from a family member over the weekend about capacity levels of programs for when we do open back up. Again, we don't have any of those details, and so I think I would be irresponsible to just start speculating on what we thought was, NuPath strategy if it doesn't work, with our funding sources and also with what we feel is a comfortable, safe level. So again, thank you to all the staff again for working over this holiday weekend. Yesterday was a holiday. I know for a lot of people it didn't really feel like the normal Memorial Day that we typically have, but there were a lot of staff coming in working on the Memorial Day and over the weekend, and truly appreciate again all their efforts and everybody continuing to pitch in from not only the working at the centers but also at all the residential homes. And so I'm going to hand it over to Sharon. I'll do a few updates after. We don't have a ton of information today, and so certainly if you have any questions, send them in. I will sort of give you some broad brush strokes after Sharon gives an update and talks about testing and the health and status. But certainly we again wait for more information from DDS, and I know in talking with Dan, he should have some updates on some other thoughts and strategies that we're starting to put in place on Thursday. So Sharon, I don't know, you want to talk about how the person's doing at the center?
So that person's doing much better. Um, their 10 days will be up on the 28th. So I'm hoping that over the next 3 days, if there's no symptoms and there's no Tylenol or a Motrin, that she'll be given the green light by the Board of Health to go home on the 29th. So that's the plan. Hopefully it goes as planned, but that's where we're at right now. We've cleaned the house that she came out of, so that we don't have to worry about that. That's been taken care of, along with the van. The many things were completed. We have 3 houses left to get tested, as you said. We have hopefully they'll be done this week, or if they're not completed, we'll have it scheduled for early next week to be completed. But this being a holiday week, we anticipate it'll be this week, but it could, trickle into the early next week as well. And then we'll figure out the round 2 of retesting people. But at least everybody will be tested at least once. And like Dan has said many times, we've keep saying that, testing is just that particular day, because you could test negative today and, tomorrow morning go to Market Basket and tomorrow afternoon start showing symptoms. So you still have to, if you're testing negative, don't think that it doesn't give you the green light to not wear your mask or let any of your guard down. You still have to maintain your social distancing and hand washing and your mask, which is unfortunate, but that's where we're at right now. So.
And so that's the mobile testing sites that you've set up those houses with, you and Matt have worked on?
Yeah.
And just, I know a question came in the other day, and just to sort of bring attention to that question, the question was, why are we waiting on any houses to be tested? Why wouldn't we all just bring them to these numerous locations like CVS centers to go in for the rapid test? And we just know that this test works well for our individuals as far as coming out to the house in their own environment, for some of them who are stressed about taking it. And so I just thought I'd mention that, as I know that
the staff at the same time. The
right.
staff that are working, everybody can be tested at the same time. It's a lot less stressful for everybody involved.
Right.
It really is, and it has been quicker getting the results now. They've over time have been able to streamline how the results are getting put out there.
Right. Good. And overall, the people whose results came in over the weekend, those were about a 3 to 5 day waiting period?
No. No. Well, I did get somebody today that I think they tested the Thursday that just found out, but I don't know if it's because of the holiday or not. So I can't answer that truthfully. Depends where you go, how long it takes, and what batch they put them in.
And so I'm just looking at a few notes of different conversations I've had with different people, staff and families. And so we're continuing to monitor staff's temperatures and everyone's individual temperatures at the houses.
Yes.
Yeah.
Start of shift. Yep.
Yeah. And that continues to be going well. PPP, everything.
Yeah. The nurses are calling, twice a day, checking in on everybody, checking on, everybody's appetite, their behaviors, bowel movements, intake, everything. So
good.
I think that's key.
Good. So so we'll wait to have those 3 houses tested again. That hopefully will happen this week, and then I think the conversation will move closer to how we deal with future cases coming in of people testing positive. as we know we can't continue to support the center to the level we've been supporting it for an indefinite period of time. And I think that that's, I think that's the world that we're in right now for everybody. And so we just need to keep taking steps one step at a time. And so the idea would be that if the results of these 3 houses have a number of individuals come in positive, we know that we want to have the center so that they could all be, do their isolation time, quarantine. Thank you. There at the center, but after that, we know then that we'll have to address positive cases in a different way. And what that means as far as going forward for day programs returning to work, as I mentioned, we're waiting on DDS's guidance for that, as well as Mass Health. And so we're not sure what capacities will be, testing, the frequency of testing for staff and individuals, and anything really laid out in those plans. It would be too premature to speculate around those. So any other thoughts, Sharon?
No.
No. Okay.
No.
I do, PPE equipment, all staff continue to wear masks, individuals wear masks, practicing social distance as much as possible, continuing to do all those strategies that they suggest. We did have some family members come for visits at the programs this weekend, and again, those family members visited outside at the programs, and so and practicing social distance and wearing a mask. And so at this point, we are still not allowing any family members or any outsiders other than staff to go into the residential homes at this time. And that is not only, NuPath's rule, that was a recommendation DDS has for us, or the guidelines DDS has set up for us. So I think those are important ingredients. And as far as NuPath, we continue to do the virtual learning, which hopefully people are taking part in that. I know the numbers continue to increase, and the feedback we've received has been tremendous. And so I just want to thank all the staff and everyone for pulling that together and really having that, be as supportive and seamless as it has appeared to be. I know it wasn't behind the scenes, but it certainly comes off very, very seamless and very beneficial to the families. And so, so that's really all the updates for today. There's not a lot to report. We've had other people who have, other houses that have gone through testing, just continue to monitor their symptoms and health, and all seem to be doing well. And so that's a good sign. That's not, we can only look at it as a good sign, meaning that some of the precautions we set up early and some of the ways we're handling situations, I think, has really paid off and allowed people to be healthy, and certainly are staying at home and practicing social distance, and the universal precaution that staff are doing at the houses, I think has all really benefited us to help control the cases and the overall cases that we've had at NuPath. So Greg, I don't know if there's any questions, anything that came in over the wire, as they say.
No questions, Dan or Sharon. Thank you.
Thank you.
Yeah. And so it looks like today will probably be a very short one, but again, I don't want to keep anyone on here longer than needs to be. If there are questions, certainly email us now. This is your opportunity, or certainly later in the day, and Dan can address those on Thursday, or we'll reply to those specifically. I know families have again continued to reach out with a lot of appreciation and support to all the staff, and so I certainly want to pass that along. And I know some family members are struggling with their own relatives having gone, been tested positive and going through, them getting better with the COVID virus and everything. And so our hearts go out to them, and to just take the care and take the time that they need to get better. And so if there's nothing else, I think we'll leave it there. Like I mentioned, Dan will be back on Thursday. We hope to have some more guidance from DDS by then, but if not, he might give you some insights and greater into some of the thinking that we're talking about behind the scenes. But right now, we really don't want to put too much out there and try to speculate about some of the strategies and have people, have that be the last bit of information they received, or be confused by that information when they see something come out that is different. We know that the state today, or actually yesterday, has loosened up some restrictions to some businesses, and people, you're starting to see a little bit of a sense of normalcy, I think, more and more. And so we anticipate that certainly in our field at some point, but we also know that we deal with a very, vulnerable population, and the health and safety is the first and foremost concern we have in making these decisions. So, all right, if that is it, I think we'll, Greg, sign off a little bit early, 3:19, I think it is. And so that's pretty good. That's the quickest one yet. And so Sharon, if there's nothing else?
No.
No? All right. Well, thank you, everyone. And thank you again to the staff and to everyone who has continued to make us proud here at NuPath and do everything that is supportive of our values and supporting the individuals that we serve, and certainly at this time supporting families as well. And so thank you, and we'll see you Thursday. Take care.
Bye.